Good evening, this is my video submission for week 5. Um, we are going to start with our patient. We're going to make sure ourselves, we check for any metals before going into the MRI scan room. And we're going to make sure that our patient have the forms completed, consent form and order form. It's good to go. We're going to provide them with comfort pads, a blanket, everything. We're going to make sure everything is sanitized and clean before they arrive. Make sure the proper coil is selected for their exam. We're also gonna provide them with emergency button, some protective equipment for the ears, and provide some music if available, and make sure we keep communication between us and the patient. And we're gonna start with the first question. It says, what coil is used and how is the patient positioned? The coil we'll be using is the HDRA 8-signal coil. The patient will be laid supine, head first, and we will position the landmark will be in the glabella. The second question says, describe the angulation and coverage for an axial brain. For an axial brain, we're gonna it's gonna be on the corpus callosum between the genium and the splenium, on a sagittal image. We're gonna cover the top of the brain to the occipital side of the brain. And then the next question, it says the sagittal brain side. For sagittal, we're gonna split between the brain hemispheres on a axial image or a coronal image as well. From left to, and make sure we cover from left to right. And for the other one will be the coronal brain. For coronal, we're gonna be it will be parallel to the brain stem on a sagittal image. Yes, parallel to the brain stem on a sagittal image. Make sure we cover basically from superior to inferior side of the brain, from the frontal sinus to the occipital end of your head. For the next question, it says, describe the angulation and coverage for the axial 3D multi-slab acquisition, time of flight for an MRI circle of Willis. For that one, we will use contrast, and it has to be done quick because we're trying to minimize the flow of the veins. We're trying to get the arteries, not the veins, but the angulation and coverage. Let's move on to the next question. It says, what kind of post-processing is done on the MRI CLW? Oh, they call it MIPing. So for the MRI CLW acquisition time, we use the contrast. However, it's done in 2D, not in 3D. And we use small slices that are 2D. So what the technologists use, they're called MIPing. So they're able to add it into the 2D sequence, and then they're able to like rotate it left and right, and then after all that is acquired, they send that to get it reviewed by the radiologist. Okay, let's go to the MRI neck. It says, what coil is used and how is the patient positioned? The coil used is the neurovascular the neurovascular array coil is used, and the patient will also be supine, head first position. It will be 2 inches below the chin for the neck. And now let's go to the next one. It says, describe your understanding of the sequence used in an MRI neck and how they are run. So for that, like we're gonna use contrast. So we're gonna be using a power injector, but before that, we need to make sure we set our planes, which is our axial or sagittal, and our coronal planes before anything, which is called what is it called? Scout. It's called Scout, and we make sure we have those three set up, and then since the time of flight it has to be done accurately and quick, we need to make sure that we um, have everything set up and it's done correctly. But before we do use a power injector, we have to make sure that we flush out all the air, because we can kill or injure our patients. Um, and same MRF, just like for the COW, they also use MIPing, and we are able to um, from 2D turn a 2D image to a 3D image, and we're able to, like, move it left and right in a 3D sequence, in a 3D fashion, and we send that to the radiologist so he can review it as well. And that's all.